My name's Sean Dugan, and I'm going to introduce myself real quick, and then I'm going to go through kind of what plan I'm talking about, acupuncture, Chinese medicine, and specifically methods for stroke treatment. And I'm going to go through a few things here on the background of Chinese medicine. Yeah, feel free to video, but I'll also have one going in case you want it later to re-listen to anything that I'm saying. So we'll do questions at the end unless there's anything that kind of really burning comes up during. So this is the intro. We're going to talk about what Chinese medicine is, the background, what this specific acupuncture technique called Xinao Kai Chao is, and acupuncture and stroke research prevention questions. So that's me. I'm a licensed acupuncturist and board-certified Chinese medicine practitioner, and my specialist training is in herbal medicine and Xinao Kai Chao acupuncture. So a little bit of how I got to be here, because people ask me, you're young, like how did you get to be doing this? So I'm 30 now, and I started studying herbal medicine when I was 18. So I've been practicing herbs for 12 years and acupuncture for 6 years. And my quick backstory is that I've always wanted to help people, and I didn't know exactly how that was going to happen. But when I was in high school, I was at like a sort of fancy East Coast prep school, Phillips Exeter Academy in New Hampshire. And my plan was to go there and go on to Ivy League schools and on to med school. But when I was in high school, I developed really severe allergies. They almost had me dropping out of school. They were so bad. And my parents were seeing an acupuncturist. And in my senior year of high school, I got introduced to Chinese medicine when I was 17. And it was the thing that helped me. So that's really what drove me into it. And I took a hard left turn and decided to go to school in California at the University of California at Santa Cruz and study botany, environmental science. And in my first year there, I met an herbalist and an acupuncturist. Can you hear me?
Yeah, no.
Okay, I'll talk a little louder. And during that, I started my apprenticeship with that acupuncturist, an herbalist, so that was when I was 18. I started studying Chinese herbal medicine, and that really just drove me deeper into wanting to learn this because Chinese medicine has the most systematically developed system of herbal medicine in the world that's been unbroken and recorded for more than 2,000 years. So I went to get my master's degree at the Oregon College of Oriental Medicine in Portland, Oregon. And after finishing school there, we moved back to Iowa. I have a lot of family in Iowa, partly because I wanted to spend more time with them, and also because my grandmother had just had a stroke when she's 86 now. She had one when she was 84. And wanted to do whatever I could to help take care of her. And she was really the reason I got inspired to pursue specialized training in stroke, because there's a lot that acupuncture can do, and then there's a lot more that this specific acupuncture training and stroke treatment can do. Because I was able to help her right when we got out of school. I was able to help her with acupuncture and with herbs to get her blood pressure down, to get her atrial fibrillation to stop, and to improve things like her bladder function. But I wasn't able to improve her muscle spasticity and paralysis as much as I wanted. So that's why I got more interested in trying to pursue this. And that's been when I've gotten into some aspect of this medicine. It's usually been from somebody that I knew personally. And some part that I knew that there was a way to help them, but I didn't know it yet. And that goes for other things, because you see somebody you want to help, and knowing that there have to be ways. Now, there aren't always ways, but Chinese medicine actually does provide many ways that Western medicine doesn't provide to help people. So that's a little bit about me. This is my clinic that I run in Boise. We moved here, and we do acupuncture, herbs, cupping, shiatsu. We moved here my fiance moved here in October, and I moved here in December. Because her folks are in Oregon, and she missed her folks and really missed the mountains, as did I. And Idaho was a perfect kind of mix of not being so populated as some parts of Oregon are. And we've really been happy here in Boise. So let's talk about what Chinese medicine is. And Chinese medicine is a completely different system of medicine than Western medicine, and it's been developed over more than 2,000 years. It's really much older than that, but 2,000 years is when we have recordings start, writings. And it's based on different understanding, and some understanding that's the same as Western medicine. And how it's been developed really is through this systematic clinical practice and through the history of China keeping that as a valued tool through different dynasties, deciding that this medicine was very important to keep through that whole time because it helped people stay healthy. So it was always a priority in China, because if the emperor, basically if the empire was not healthy, people died of epidemic disease, things like that, the emperor didn't last on the throne. Like if the people are unhappy, that's not how that political system worked. And so it's very important to keep everyone as healthy as possible. And if you look at the history of China and the Cultural Revolution, in this last century, a lot of cultural aspects were lost, destroyed, discarded. Chinese medicine was not one of those, because it was too practical and valuable to discard with. So there's 5 main treatment modalities in Chinese medicine. We use Chinese herbal medicine, acupuncture, and moxibustion, which I'll talk about a bit. Body work, Tuina, shiatsu, or different types of Asian therapeutic body work, and then we use diet and exercise as well. And these are listed in order of their relative strength. Chinese herbal medicine is generally the strongest treatment method that we have, and it's often necessary for getting people through chronic illness and severe problems. But especially with stroke treatment, acupuncture and moxa are invaluable and extremely important because of their effects on the neurovascular system. So moxibustion, a lot of people, have you ever heard of that? Anyone? But you've heard of acupuncture? Yeah. Maybe. So everyone knows about acupuncture, and this is the word that we translate to mean acupuncture, zhenzhou, and that's the pinyin writing of it. This means needle, and this means moxa. So it's actually, moxibustion is a therapy where we use we burn a particular herbal substance over the body in order to warm that area, add metabolic energy because of the combustion to the body, and then it affects the immune system and circulation because of the volatile oils that drag through the skin. So this is actually a very important part of moxa, especially, for example, in stroke. If you have cold limb, if something feels cold, means there's not enough blood circulation and it is actually cold, so we use a warming therapy. And this isn't as well known in this country because people don't like burning stuff and people don't like smoke, but it's very important because it's actually half of the practice of acupuncture. There's a saying that goes, if you go to an acupuncture clinic and don't smell moxa smoke, run the other direction. Which I don't think it applies to all people, because there's actually a lot of really excellent acupuncturists, and you can get amazing results with only needles. So, but moxa is also really important. It's really valuable, especially with stroke treatment. So what makes Chinese medicine unique? There's really a lot of things we can talk about that make it unique and make it different than Western medicine. And by the way, I'm very pro-Western medicine, but I'm not pro-only Western medicine, because there are many things that it has to offer that Chinese medicine doesn't, and there's many things Chinese medicine has to offer that Western medicine doesn't. So the best case scenario for everyone is to use every treatment method we have and have all of them on the table. That's how people get the best results. So what's unique, perhaps the most, is our diagnostic methods. And so here I say the Chinese medicine diagnosis is more specific to the individual than Western diagnosis. And when you initially read that, you might think, well, yeah, but they use labs and they use numbers, and I use pulse, and I use looking at people's tongues and asking them about their signs and symptoms. But the major difference is, in Western medicine, you'll have people with one diagnosis, say hypertension is a good example. Not everyone with hypertension has the same problem. They do have the same problem that there's more pressure being exerted on their blood vessels. That's the classification. But you can have one person, it's very common, say one person has a red face, they're big, they feel hot all the time, their blood pressure gets high when they're angry. A different person has hypertension, they feel cold all the time, they're thin, pale, their blood pressure gets high when they're cold. And if they get in the hot shower or hot bath, their blood pressure goes down. Now those are different conditions, even though they have the same disease class. So we take every diagnosis, whether it's hypertension or migraines, headaches, or stroke paralysis, and we differentiate it into further categories. And in Chinese medicine, so anybody who has, if you come in the door and you have hypertension, we treat 10 different people 10 different ways, depending on how their symptoms and signs line up. So that's why we're actually being more specific. And then what's acupuncture? So a very simple definition, and this is what acupuncture is the insertion of a filiform needle, which is a solid, tiny needle, acupuncture needle. They used to be very large. If you look at historical texts, the original acupuncture needles were stone, and you probably wouldn't want anything to do with it today. But today they're extremely tiny, and you can fit about 100 acupuncture needles into a hypodermic needle. So if you're familiar with a syringe needle, it's really nothing the same. It doesn't feel like a shot. It doesn't feel like a bee sting. It doesn't feel like anything like that if you've ever had it. And there are many schools of acupuncture techniques. So just like there's many different medical philosophies, even in Western medicine, different doctors have different takes on how to do things. The same is in Chinese medicine. So there's different herbal schools of thought. There's different Chinese medicine schools of thought with acupuncture. So here's a few. Our Chinese, Japanese, Shinao Kaichao, which is what I'm going to talk about today, trigger point acupuncture, Master Tan, there's lots of them. And then take a minute, I'm going to invite you to forget and set aside everything you've heard about Qi, meridians, and energy, because these are Chinese, when we translate Chinese words into English, it can get really messy, because unlike Spanish or French, Chinese is not at all similar to English language. And so a lot of problems in understanding what's going on with Chinese medicine have arisen from mistranslation and misunderstanding of these terms. So if you're really curious, we can get into it later. But first I want to talk about this specific acupuncture method. So Shinao Kaichao is an acupuncture method developed specifically for stroke treatment. And it's been developed and researched for stroke treatment in China for over 50 years. Developed by this doctor, Dr. Shi Shuimin, and utilized at the hospital at Tianjin University in Tianjin, China, which currently treats 10,000 stroke patients a day. Am I blocking you guys? So this is used on a high scale, and the reason it's used on a high scale is because of its effectiveness. It's a set of specific acupuncture techniques and using specific points and also specific needle manipulation methods that were developed by this doctor specifically to help with stroke treatment. So it's developed by Dr. Shi Shuimin, who's known in China as the father of acupuncture. The reason he has that title is because he was one of a few people in his position who survived the Cultural Revolution. And during the Cultural Revolution, a lot of people lost their lives through war, and a lot of the old knowledge of Chinese medicine was not being passed on. And he was tasked with going to the older acupuncturists and Chinese medicine practitioners and bringing what they were teaching and bringing it forward into the future, because the younger generations were not learning it and they really needed it to be part of their medical system, is what they felt. So there used to be, you've ever heard someone say like ancient Chinese secret. This phrase, it really has to do with the fact that a lot of these methods for a long time were kept secret, were isolated to family lineages. Because within a family lineage, in China, if your family had a tool, like if your family had a skill like medicine, you did not just give everyone that skill, because you taught it to your family, to your children, and their children, and you would always have a job, and you'd always have a reason to be alive in that dynasty. So that's why this teachings weren't just shared everywhere, but now things have changed, and during the Cultural Revolution they did change because they wanted to bring this medicine to the forefront, research it more, use it more. And so he was one of the doctors who was able to go and bring some of this older knowledge into the future.
Would you repeat what you said about why did they have a reason to be alive? What did you say about that?
Yeah, so China's history is somewhat tumultuous, and basically trades were kept within family lineages. So if your family was amazing at painting, you didn't necessarily just teach everyone else to be amazing at painting. You would teach your family members, because then they would have a job insured and also a reason to be alive in times like the Cultural Revolution, when many people did not survive that regime change. And if you were of value, if your skills were valuable, couldn't be dispensed with. And
Wow.
that's why medicine was not necessarily shared with everyone, because it's an indispensable skill. And there's a story about Dr. Schur that everyone used to wear these long sleeves, very long sleeves, and the reason they would wear them is because when they would do an acupuncture technique, you wouldn't be able to see it. You wouldn't be able to see what they were doing with the needle. You knew they were putting a needle in, but you couldn't see it behind the sleeve. And when he went to go learn from these older teachers, they were doing that, and he said, you know, listen, you need to roll back the sleeves, because if you don't teach this to me, it's dying. It will not pass to the future. No one's going to get this, and it's not going to help anyone. And so they did, and they showed him these methods. And so he was given the title of Distinguished Academician, which is a title given by the Chinese Academy of Engineering, usually to people in the sciences, for engineering, science research, and he was given this because of his work with stroke. And so, Dr. Xu is my teacher, who went to China to do his PhD with Dr. Shi Min, and studied there for years to learn this method and be able to replicate it and teach it. And so he runs a clinic in New York City now, and his mission is to train as many US acupuncturists in this method as possible, because it is the most effective acupuncture technique. And acupuncture itself is the most effective treatment method that we know of for post-stroke treatment, more than anything else. So, you know, when you have the stroke, of course, you want to go to the hospital right away. But after the stroke, so far, research, there's nothing that has found a method more effective than this treatment method for helping people recover, function, and restart these neurological functions. So really the goal is to have Xinao Kaichao trained acupuncturists in every hospital ward, in every stroke ward in the country, because there's many things that acupuncture is okay at helping with, right? But this is something that is amazing at helping with. And really we want to take every medical tool we have and apply it where it's the most effective and has the most impact. And there's a lot of things that people use acupuncture for that it does help with, but this is something that impacts people's lives in a huge way. And that's why it is so interesting to me, because I've experienced family members, right? And you see how much impact this has on your life. If there's anything we can do, we should be doing it. This is a goofy picture of me with Dr. Xu, and I have this huge grin on my face because after years of studying acupuncture, I never saw anyone who had his level of skill. And so I've been very excited to study with him. At the most recent seminar with him, we were able to see him help patients that most patients you don't expect to get any better. One was a severe brain injury, a young woman who was hit by a car going 40 miles an hour. Another man was a severe spinal cord injury. And brain injury is how it presents basically is the same as stroke in terms of the long-term impact on aphasia and paralysis and things, because the stroke creates brain injury. So being hit by a car also creates brain injury. And both those patients have recovered beyond what anyone thought was possible. Most of their doctors didn't think they were going to survive. So it's really, really amazing to see this kind of work and what it can do. So let's look at statistics on Xinao Kaichao based on the Tianjin Hospital. So acupuncture really is the single most effective post-stroke treatment. And we just look at the numbers from this hospital, and we see that the patients who receive these treatments have better outcomes than patients in the US who are given standard post-stroke care. So here is one. This is about the ability to walk unassisted. So 85% of patients at Tianjin are able to regain the ability to walk unassisted compared to 51% in the US, which is a pretty significant difference.
That's amazing.
Yeah. And the ability to live at home, 98% of patients in Tianjin return to living at home rather than a long-term care facility, compared to 68% of patients in the US. So it's a third better. And the difference in this care is that they're receiving acupuncture. They have the same Western medical facilities, same everything else, but acupuncture is integrated in the medical system. They're getting acupuncture treatment every day. They're getting it as soon after the stroke as possible, which is usually 1 week, like after people have a stable status, usually when they will start treatment. In China, they'll often start it faster, but here, usually we say 1 week because people are just so much more not used to acupuncture, not familiar with it, that we have to kind of be more careful with how people view it. So, yeah, so that's really, this is a major impact. And there's further benefits, is that they see a change in these patients, see a reduction in secondary strokes, decrease in blood pressure, decrease in cholesterol, and many of these stroke side effects like aphasia, dysphagia, paralysis, and muscle spasticity are able to improve with this treatment. Many times patients who are given the diagnosis that this will never improve. And so Dr. Xu has been able to reproduce these results in his private clinic because it's a different setting, and so he was concerned when he went over to China that he wouldn't be able to bring this back and make it happen the same way, because they're getting treatment every single day. In Tianjin, they're getting a lot of acupuncture treatment, and he's been able to help a lot of people with stroke, with aphasia, and then also with other brain injury, traumatic brain injury, Parkinson's, neurological disorders. And then he's been able to get his students to see these improvements as well. So when I mentioned at the beginning, but when I was treating my grandma with acupuncture and herbs, we were able to help with quite a lot with the AFib, with the blood pressure. But now that I've trained in this method, I've seen a much better improvement in my ability to treat her paralysis, get her movement better, and her cognition and speech better. And so I've been able to use these methods to help people improve their gait, improve their cognition, improve their speech. And then also with Parkinson's and traumatic brain injuries. So we had a patient this year who had a brain injury, fell down a flight of stairs when she was 6, and then a month later she had scarlet fever. So she developed a significant brain injury at a young age and developed a tremor because of that. Over time, the tremor got worse, and Parkinson's diagnosis is still pretty iffy these days as far as understanding what's going on between essential tremor and brain injury. In any case, the condition's getting worse, and she came in for treatment, and we were able to help her quite a lot to control the tremor, and also to control her PVCs, another heart condition that she has going on. And she's 60, and nothing she'd done in her whole life had changed the tremor at all. Propranolol, all the drugs, lots of treatments, and nothing had changed. So it's really, and when I say this stuff, it's not because I'm amazing, it's not because I'm particularly good at this stuff, it's just this is what the medicine is capable of. And yes, I just want to revisit these statistics after doing a little subtraction here. So Tianjin sees 34% higher rate of patients able to walk unassisted, and 30% more patients able to return home. And the difference between these treatments, the difference between these outcomes, is that the patients are able to get acupuncture. So I want to look at a little bit of research here, and then I'll kind of try to wrap up and put questions, for any questions you have. But this is an fMRI study, brain imaging study, looking at the effects of acupuncture in chronic stage stroke patients with aphasia. And this study followed 10 people getting acupuncture and determined, as you see there, that a significant correlation between changes in the aphasia quotient and blood oxygen level dependent activation in the lesion Wernicke speech area of the brain was found. So these suggest that acupuncture is beneficial to language recovery in stroke patients, including chronic stroke patients. Another research study was a meta-analysis of literature review on, I can send this to you guys as well if you want it, on the impact of acupuncture on aphasia after stroke. And the acupuncture group scored the highest in their improvements in recovering language. The best group was the group that was doing acupuncture and language therapy compared to any other groups. So those two things together. And it's worth mentioning, I don't have it in the slides, but for mobility issues, acupuncture scores the highest, but acupuncture combined with PT often does really well. So PTs can basically help to reduce some of the muscle tension and spasticity, doing myofascial release techniques and things. But people who get both acupuncture and PT respond a lot better than people who are just getting PT alone. So we can talk about prevention a little bit, which may or may not be that interesting to this group. But I think it's useful, and it's useful to share with people that you know, and also for the future, because as many of you have already told me, once you experience a stroke, the likelihood of experiencing a secondary stroke is much higher, which is one of the great benefits of that you saw Tianjin's patients get, is that their likelihood of having a secondary stroke is much less. So we can help with preventing stroke by treating heart rhythm disorders such as atrial fibrillation, controlling blood pressure, reducing cardiovascular inflammation, and treatment of other risk factors like high cholesterol, sleep apnea, and treatment of pain, because inactivity is one of the biggest risk factors, and people who have pain are much more likely to be more inactive. And if you're seeing now in the news and things that acupuncture is becoming a frontline treatment for pain, for chronic pain, acute pain. Tennessee's Blue Cross Blue Shield recently replaced the standard of care of opioids for chronic pain with acupuncture, because opioids do not work that well. I mean, they're good to have, right? They're a good drug to have, but they also kill a lot of people. Yeah, they do. And they don't actually do anything to reduce the problem, right? They trick your brain. I've taken opiates, if you've ever taken opiates, they trick your brain into saying, you don't have pain, but you still have the same level of inflammation, tissue damage, and actually your body still has the pain. But your brain says, I don't have pain right now. And the problem with that is that our brain's capacity for addiction to dopamine is amazing. So anyway, so when we talk about treatment of cardiovascular disease and prevention, there's a couple things I like to say, because a lot of people think acupuncture, Chinese medicine, oh, it's just this esoteric stuff. How could it treat serious things like heart disease? Well, the thing is, I actually see better results with treatment of cardiovascular disease. So atrial fibrillation. Now, it's good to have cardiologists, it's good to have all these treatments on the table, but when it comes to irregular heart rhythm disorders, the main ways they approach it are not ways that seek to solve the actual heart rhythm problem, which is what makes the increased likelihood of throwing a clot. The chambers of the heart aren't beating evenly, so one chamber might pool blood, form a clot, throw it, create a stroke. So the methods that they use usually are slow the heart rate with beta blockers like propranolol, give a blood thinner just to reduce the risk of the clot forming, but doesn't do anything about the heart rhythm, and then some different types of they don't say they're experimental, but they are, just shock the heart and see what happens, like electrocute some heart nodes and see if it works. It is, see if it works, right? And sometimes it doesn't, sometimes it doesn't. But what we do with Chinese medicine treatment, with herbs and acupuncture, is we actually change the heart rhythm and actually get it to restore so that there's no need to take blood thinner. So this year, a couple months ago, we had a man in his late 40s come in with atrial fibrillation, and he's 48, so he's a mountain biker. He didn't want to take Xarelto for the rest of his life. Didn't seem like a good solution to him, right? And I totally agree. It's not a good solution. It's not a good long-term solution. And the other options were, shock his heart, maybe it'll work. He didn't like that idea. So he came to us in the early stages, which was really nice because he wasn't on Xarelto yet. But he did have a continuous heart rate monitor, which is helpful because we could see exactly what's going on. He came in, he was in AFib 14% of the time. That week he started herbs, dropped to 0, and he hasn't had an AFib episode since.
Wow.
Right? And you wonder why is Chinese medicine good at treating heart disease? So, like I said in the beginning, we're more specific, actually. We're looking at every AFib patient, we do not treat the same. We treat them all differently depending on what signs, symptoms, pulse, all the things that are actually specific about their condition. It might be the same as somebody else's, but it's take AFib, break it down to 10 other parts, right? And then we're going to treat one of those, and that's why it works. But another part is just history. So, do any of you know when Western doctors figured out venous blood return?
Can you repeat that?
Yeah, sorry. When Western doctors, so venous blood return is the understanding that the veins pump the blood back to the heart. So we have the blood squishes all the blood out. The heart squishes blood out to the extremities, but how does it get back? And the veins have these little pump systems that squish it back up and get it back into the heart. And in Western world, Galen, for a long time, for 1,000 years, Galen's theory was just magically it just comes back somehow. They saw that the heart squished the blood out, but they didn't have any idea why it got back. It wasn't until 1600 AD that William Harvey looked at the veins and said, oh, they're squishing it back up. So 1600. And guess when the Chinese figured it out? 300 BC. So 1900 years before, right? And we have this idea that Chinese medicine is dated because it's old. And other things like that it might not be valuable because it's Chinese. Well, most of the things we like are Chinese. Noodles, In America, we like guns, gunpowder, silk is real nice. Chinese food, spices, a lot of things have come from China that we find really valuable today, right? Yeah, and we're looking at the whole picture. We're looking at the big picture. Anytime someone comes in, we're looking at their whole health. And there's a saying in Chinese medicine, like, if you look too close, you can lose the forest for the leaves. So it's amazing to have the microscopic abilities of Western medicine we have today. But a lot of the time, we're looking at a tiny leaf, and we're trying to understand what's wrong with the forest. But the leaf we're looking at might be fine. And a mile over, the forest is dying. And unless you take a big picture and look at the whole thing, you're going to miss it. You're going to miss what's going on. We're going to not catch it till 10 years later. So we're trying to find things. We're trying to catch things 10, 20 years before they happen. We're looking at cardiovascular disease decades before EKGs will catch it. And an EKG is the test, right? A lot of people have probably had a stress test, EKG, right? So it's a good test to have, but it's not a specific test. It's not a sensitive test. It only catches a problem in your coronary artery when it's 70% blocked. 70% is a lot to me. So if my coronary artery is 50% blocked, I want to know about it. That's half, right? And an EKG won't catch it. So then we see, well, what do? We look at the pulse. How's that? That's crazy, right? How can we feel someone's pulse and tell, well, the pulse is a direct reflection of how your heart's beating, and it is part of your cardiovascular system. So I'm getting a little bit off my track here on cardiovascular health, but I'm really passionate about it because it's the leading cause of death in this country. And the reason it is because Western medicine does not have it all locked down, and we can do a lot to help with it. So another area you see is blood pressure, right, which is another major stroke risk factor. And blood pressure, like high blood pressure patients are often treated with the same set of drugs. There's different ones, and some ones work better for other people. Like lisinopril works good for some people, other people it doesn't do anything. Beta blockers are a good short-term solution. They're not a good long-term solution because you're going to be tired forever. I'm on a beta blocker. So, and then we get people in my clinic who are on 5 different blood pressure meds. Their blood pressure's still not down. That was like my grandma. She still had AFib. She still had high blood pressure. She was on 5 meds and cardizem and things to try to regulate her heart rhythm, and nothing was working, right? So what worked? Chinese herbs and acupuncture worked. And you can see it fast. Doesn't work this way with everybody, but you can see on her, we have an EKG watch, see what her heart's doing, and you can just feel it. If you know how to feel the pulse, you can feel it, your regular heart rhythm. Within seconds of putting a needle in, you can get her heart to go back. And yeah, so high blood pressure responds remarkably well to Chinese medicine treatment, and we're actually looking at it much deeper. And if you look at the Western medicine understanding of why is blood pressure high, they actually don't have an answer. 95% of hypertension is classed as essential hypertension. If you ask your doctor what's causing essential hypertension, they don't know. So 95% of hypertension diagnoses doesn't mean anything other than your blood pressure is high. It doesn't tell you anything about how you got there, why it's happening, any of that. So I want to look at this. This is another part about prevention. So this is incidence of stroke in patients with atrial fibrillation, comparing traditional Chinese medicine, that's TCM, users to non-traditional Chinese medicine users. So this study, they started with 14,000 people, and 2,000 of them were in this closer criteria because they want to look at people who were diagnosed with atrial fibrillation and given medicine within 7 days.
And the sample size?
Yes, and the sample size. Yeah, so they start with 14,000 people, but they exclude people who were given AFib diagnoses and had a stroke afterwards. So they want to look at, you got the AFib diagnosis, you're treated within 7 days with Western or Chinese medicine, and then do you have a stroke or not?
Okay.
So most people are treated with Western medicine, not TCM, so this is a bigger sample, but 12.59% of the people not using Chinese medicine had a stroke, even with Western treatment. 1.93% of TCM users had a stroke.
So this is for second time of
This is
stroke?
for first time.
Oh, first
This is
time.
first stroke. This is first stroke with atrial fibrillation. But you can take this understanding that basically here, Chinese medicine reduces the risk of stroke 6.5 times in this AFib study compared to not using it. And that will also apply to secondary stroke after the first stroke. So in general, this is specific to atrial fibrillation, but this is just an example to see how this reduces stroke risk, which is quite dramatic, really, 6.5 times. Yeah.
Sorry, and the atrial fib
Yeah.
is having blood thinners or not? For stroke?
Yeah, most likely in the Western treatment, they're going to give them a blood thinner, and they're going to do everything they can with Western drugs. They're going to hit every Western drug they can to try to reduce their risk, right? But the problem is if you don't actually regulate the heart rhythm, which a lot of times they can't with those drugs, then the risk is still higher. The DCM's been regulating heart rhythms for a long time, and it's good at it. And that's why the risk is so reduced. So thanks for listening. Do you want me to keep that up, or keep that up? Yeah. So I hope this is helpful. Really, what I want to do is help spread this information, both for prevention and treatment. Because acupuncture is really just one of the best tools that we have to help people with this. Yeah, and so, we just want people to know. We really want people to know about this, and we want your doctors to know about it, right? Because the more we can change the way people understand this medicine and how many people know about it, it comes from demand. So if we want more acupuncturists trained to be in hospital wards, we want all insurances to cover acupuncture. That happens when patients demand it, and it also happens with insurance companies, and now they're starting to see insurance companies save money when they use acupuncture, right? Which is why they now start to cover it. But it takes a long time in different states. Idaho's pretty far behind on the insurance side, to be honest. But if you go to your doctor and you demand it, and you say, I want this treatment, they can eventually make it happen. You know, it's a slow battle, but it really comes from saying, we value this, we want it, and you need to give me a referral to an acupuncturist. Yes, we'll go questions.
Herbs?
Yeah.
Herbs.
Yeah.
Herbs.
What kind of herbs?
Yeah.
Well, let me actually, I don't have a slide for it. One of my questions that I thought people might ask,
Thank you.
what about herbs? What's your question?
What time?
Like what kind of herbs?
Yeah.
Yeah, so I specialize in Chinese herbal medicine, right? And I'm probably 5% of acupuncturists who do, because it's a different study than acupuncture. And in China and Japan, people usually divide, they study acupuncture or they study herbs, because each one is a huge field. I study both, because acupuncture is too useful not to use. But herbal medicine really is the strongest treatment method that we have, and it can turn things around when nothing else can. So in that beginning part, there's this hierarchy. It's an old story, sorry for the flipping. It's an old story that goes, in the beginning of time, like acupuncture is too useful not to use. But herbal medicine really is the strongest treatment method that we have, and it can turn things around when nothing else can. So in that beginning part, there's this hierarchy. It's an old story, sorry for the flipping. It's an old story that goes, in the beginning of time, like 10, 12,000 years ago, when we were early in our species development, the people did not get problems in the ways that animals don't get sicknesses like we get today. Animals can get sick, but they don't get the same kind of sickness that we do. And so in the beginning, people developed exercise, Tai Chi, Qigong, lifestyle practices like go to sleep on time, stuff like that. And that could prevent disease. And the next layer is using diet to prevent disease. And this works its way up until today, many people have a disease that nothing can reverse except for herbal medicine. And so when we're talking about herbal medicine, Chinese herbal medicine is specifically, there's no like one herb for anything, right? So similar to in that diagnosis where we break it down into these different categories, there are thousands of herbs and thousands of formulas of possible combinations of those herbs that we'll use. So probably no one in this room would get the same herbal formula because no one has exactly the same condition, right? We use different, when you do group everyone who has the same diagnosis, more things are more common, right? But 10 headache patients get 10 different formulas because we want one that actually works, and that's why this works. So the herbs I use they're all Chinese herbs. Most of them are not things you've particularly heard of, probably. Some of them might have been, but we use them in formulas, not alone. The Western herbal tradition, which is what I started my interest in herbs, is really useful, but nothing has the same systematic development like Chinese medicine because we have these books, right? So we have our major book in 600 AD was published, and people have been reading that book and treating patients with it, and writing commentaries saying this worked, that didn't work, this worked, that didn't work, you were wrong about this, new system of disease, Ebola comes out, new understanding of how to treat that that system didn't work. So it's this very long progression of keeping and recording what's going on with these formulas. So the formula that I use today is one that's developed in 600 AD, or written down in 600 AD, probably developed much before that. So they have a long history of use, and they've treated millions of people by this time. But it's all about understanding the particular pattern presentation. And it's important to understand that herbs, in China, they do not view herbs as different from drugs. So they're a pharmacological, biologically active substance, right? They're weaker than drugs because when you take, well, weaker and stronger at the same time. Like an antibiotic is one concentrated form compound that does one thing. An herbal drug, an herb, which in China they use the same word, yao, means medicine, and they use the herb, drug, doesn't matter to them. They just care about what works. So they'll actually put herbs and pharmaceutical drugs in the same pill because they don't care. They just want to use what works, right? It's not here to us, it's like this ideological difference between Western medicine and Eastern medicine. It's not a belief system, it's just what works. So the herbs, like you might have heard of red sage, maybe, salvia, miltariza.
Yeah.
It's a herb we use a lot for hypertension and heart disease and reducing stroke risk. I give that herb to a ton of patients. And another thing that's important to understand about herbs is sourcing. So people have an idea that Chinese medicine can be dangerous, and it's not any more dangerous than your iPhone or any other thing that we have that comes from China, but it is important to use quality sourcing. And in the past, in this country, that wasn't really possible. Today, we're really fortunate that we have companies that provide organic, wild-crafted herbs that do extensive pesticide testing, heavy metal screening, all those things so that it's very safe. But it's strong medicine. You don't want to just prescribe it yourself. Like you don't, unless you're a doctor, you don't necessarily want to go, like you don't want to go to the pharmacy and just order up, a beta blocker, right? Because if it can help you, it can hurt you. And it's the same with herbs. So the right herb helps the right person. That herb does not help somebody that it's wrong for. Because I wish I had these characters up here, but the word that means formula, fang, means direction. That's the thing about Chinese language, right? One character means many different things. That's why it's so confusing to translate. So the word that means formula, like what's the prescription, it also means direction, which implies that like somebody's here, like this is perfect health, and then we go this way and say I get really cold all the time and I'm really tired and stuff like this. Now I need specific type of herbs that push me this direction to get back to health. And if you're someone who's over here and they feel hot all the time and angry and have tons of energy and super wound up, and you give those same herbs to me, I'm just going to keep going in that direction. I don't go back to center, which is where I want to be. So it's important to be specific about them. And then it's also important to dose them right in ways that are therapeutic. And one thing that's nice about like over-the-counter herbs is that they're dosed really low, so you can take the wrong stuff and it probably won't hurt you, but it also probably won't help you that much either. When you really want something to get done, you use a dose that's 50 to 100 times higher what is in like a capsule formula or something, or like some of the tea pills that you buy in the store. Yeah, herbs. Other questions?
And the pills are more or less herbs, like that's an herb.
Which one?
Dilaudid?
Oh.
But
So every single pharmaceutical drug that we have came from a plant.
Yeah.
We didn't figure them out. Like the reason we learn from nature, we go and we say, oh, that drug, if you take it, like if you take foxglove root, you'll die real quick of a heart attack. But somebody said that must affect the heart. So what if we take a tiny percentage of that, concentrate it, and use it for people with a specific heart problem? Then it's a drug. So we learn all these things from nature. The big difference is that herbs and drugs are not nearly as forceful. So a drug, it has one mission, and it's going to do that mission, and it doesn't care whatever else stands in the way. That's why we get side effects, because it pushes stuff out of the way. It's going in and saying, I'm going to do this. And herbs are different because they have, instead of one molecule, one compound, they have thousands, and those thousands balance each other. So ginseng, renshen, within it, it has compounds that raise blood pressure and lower blood pressure, right? But together, the body uptakes what it needs. So you can use that herb to treat people with high blood pressure or low blood pressure. And the body's sort of smart enough. Also, we've evolved with these plants for millions of years. So we have like a relationship to them, an understanding of how to excrete it if it's not necessary. And things like antibiotics is where you really see some interesting stuff come out, because an herb that's antibiotic will have, again, hundreds of thousands of different molecules in it, different botanical compounds. And when you extract one and make an antibiotic out of it, bacteria are super smart, and they form resistance to that, and they say like, nope, we're going to fight that. You can't get resistance to herbs. You can't get antibiotic resistance to herbs. So I treat people with antibiotic-resistant pneumonia, antibiotic-resistant infections all the time, because if the antibiotic doesn't, and trust me, antibiotics are amazing. There's no reason I would say, like, that's why we all live to the age we live now, really, is antibiotics. So they're amazing drugs, but they're not everything. And now that we've been using them for so long, we do have all these antibiotic-resistant strains. So that's one thing that is really helpful. Anyway, that's kind of a side thing, but yeah.
So like, when my strokes happened, I got acupuncture right away, and I think it really helped. You mentioned that a young girl had a tremor, and when she was 60, I guess.
So she's this, yeah, how long? How long
Yeah,
did she
so
get
like,
afterwards?
I do remember in the hospital, they'd say, you'll plateau in a year, and I don't believe that. I
Right.
think everybody can get better throughout their life for their recovery. So is there a time frame? when you
So
start?
when I was in acupuncture school, that's what they told me. They told me, after a couple years, like, don't bother. But that's not the experience of Dr. Sure, it's not the experience of Dr. Shu. So they treat people who had strokes 8 years ago, longer, and I'll never tell you that I have the skill level that Dr. Shu does, because I don't. And if you really wanted that, I'd fly to New York for real. But he's done amazing things with people who've had aphasia or really impaired mobility for 8 years or more, and seen them, dance. And he's like, go back to walking, sometimes in a couple treatments. And that's not something that I tell people to expect. Usually it takes many treatments. And usually the improvements are small. But for example, with this tremor patient, she's 60. She's had a tremor for 55 years. Nothing touched it for 55 years. She has confirmed lesions in her brain damage. Nothing has done anything for it, but acupuncture does. And it's not completely gone. We've been treating her for a couple months. So we'll see what happens. But there's almost always improvement to be made. And how we treat it with Shinao Kaichou protocols, we see people for 10 to 20 visits, and we evaluate how the improvement is going. If we're not seeing a change, then we say, you can continue, but we try to be careful with people's finances, and say, like, we try to be responsible as, is this making a change? For some people, it's a change that they couldn't move their thumb, and now they can move their thumb. But everybody's at a different place with what change means. So for someone who's had a tremor for 55 years, and they can use their mouse again, to them that's huge, And their next goal is that she can drink coffee with her right hand instead of her left hand. So we make these things happen. But, where's my, I got a little thing about that. Yeah, so this is a big question, is the damage permanent? And what the research that they have found is that the penumbra that develops around that damaged area of the brain, that these functions of that part sort of retreat into that area around it, the shadowed area on the MRI, if you're familiar with looking at that, and that those functions can be reawakened, which I don't know if I said it. That's why this method is called awaken the spirit and open the mind. That's why it's called that, because their understanding is that these functions go dormant in that penumbra. They go dormant and they can be woken up.
Neuroplasticity.
Neuroplasticity.
Yeah.
And some people, we're learning more about that all the time, right? Used to be that these certain areas of the brain, they thought only do that, right? And then they started dissecting people who have died, and they learned to walk again after the stroke, and they thought, how could that happen? Because his motor function area is completely destroyed. He has no brain matter in the motor function, because a different part of the brain said, I'm gonna walk, And yeah, so nerve damage, a lot of doctors will tell people neurological damage is permanent. And that's not been the case that I see, one, from using this with stroke, from all kinds of other things like neuropathy. People come to me all the time and say, my doctor said there's nothing you can do about this neuropathy. erectile dysfunction after prostatectomy. They said, yeah, they cut the nerves, nothing's ever going to happen. Well, the thing is, nerves do regrow, and they'll say they don't, but the very important thing to know is that the nerves regrow when there's a reason for them to regrow, and that's why you use the acupuncture stimulation. For example, in neuropathy, a lot of neuropathy is caused by cardiovascular disease like diabetes, things like that. So we have these big veins, and they get arteries, they get littler and littler as they go to extremities. And the places you see this first are the feet and the genitals, usually in men, because they have the tiniest capillaries. And if there's some problem with the cardiovascular function, the tiniest ones shut down first. There's like the body's saying, yeah, we're not going to put blood there. And then the nerve responds secondarily saying, there's no blood going there, that's not living tissue. Like why does the nerve function, why does the nerve flow need to go to that area when there's no blood flow there? So once you get the blood circulation to restore, and you spark the neurological signal again, like you spark the nerve signal, and with this method we use the needles to stimulate nerves directly, then the nerve can go back to that area and say, there's a reason to be there. So with neuropathy, we get the blood to flow to the toes. And when the blood flows to the toes, the nerve has a reason to go back there, and it'll go back. So that's just kind of it will be coming. Doctors will understand this in the future, but they're not 100% there yet. And it's easier to treat it sooner, but that doesn't mean you can't treat it when it's been a long time. Yeah.
3 questions, and I'm going to
Just
get
making sure
this
we have 5 minutes.
quick.
Yeah.
Is Medicare paying for that?
No, Medicare in Idaho. They're trying to get acupuncture coverage. My clinic, I don't take insurance other than VA. VA is the only insurance I take in my clinic.
Except for which one?
VA.
Oh, VA.
Yeah, take VA, and that's a problem. That's mostly because when you're a small clinic, like if you're a big hospital, the insurance companies decide not to pay you, and it's not a big deal. When you're a small clinic, and 5 years later the insurance companies decide actually we want all that money back, we're not going to pay for that. It's kind of a big deal. And certain companies, like the VA, pays for acupuncture. They're one of the biggest supporters of acupuncture. Yeah.
Yep.
And the reason is, like, you look at, okay, is acupuncture esoteric, whatever? No, it's not. The Army's practical. And they say, we have people in pain, we have people in emotional pain, here's something that works for it, we're doing that, you know? So they're a really good example of why this is just a medicine, it's just a tool. There's no ideology behind it, which a lot of people think. That's kind of been misconstrued over the years. Yeah.
Quick.
Okay. Number 2, right?
Do you treat glioblastoma? Not the stroke, but
So I'm not really familiar with
brain
glioblastoma.
cancer.
Well, the answer to that is that no one treats cancer in this country legally. You can't say you treat cancer unless you're doing radiation or chemo or surgery. So no one can. Anyone who says they're treating cancer, can easily be disbarred if they're not doing those 3 methods. And it doesn't matter how scary the disease name is. So people come and they say, like, I've got this 10-word diagnosis. Can you help me? Generally we have to come in to find out because we don't operate based on that diagnosis system. So a lot of times people have 70 Latin words to their name and they're on a boatload of medications. They don't feel right still. So just because you have a fancy diagnosis doesn't mean you have the treatment. And with Chinese medicine diagnosis, the treatment follows the diagnosis. So anytime we have a diagnosis, and it's going to be Chinese language, right? It's not going to mean anything to you. It's going to be that you have Taiyang Shang Han, right? It doesn't mean anything because it's literally Chinese. That's where the system's from. But to me it means something. It's how I understand what's going on. And I treat it based on that. And if it gets better, then my diagnosis was right. If it doesn't get better, then my diagnosis was wrong. And that's how Chinese medicine works. It's different than Western medicine where they have a diagnosis. Diagnosis doesn't mean treatment. It doesn't mean treatment that works. If we're a diagnosis and the treatment that fits with it don't get a person better, then we go back to the beginning and we say we must have been wrong about that. It must mean we didn't understand it well enough. Because the results are a proof of understanding. So if medicine treats a problem and it doesn't go away, that's because they didn't understand it well enough. And some problems are just hard. Some problems are just really tough, and not everything can be changed as much as we would like it to. But there's a really different set of responsibility in the way that Chinese medicine looks at treating people than Western medicine, which kind of says, like, I don't know, you're screwed, like we'll give you a fancy name and we'll do some stuff. And if you don't get better, it's your fault. Generally, we say if you don't get better, we didn't understand it well enough. You know, occasionally if people don't take the herbs or, you know, people won't do any exercise or eat differently, like that can be an issue. But in general, if we don't see recovery and improvement, then we don't consider that we understood the problem well enough. Yeah. Yeah.
And that's it.
Sorry for taking up so much time.
So,
No, it's
Sean,
great.
do you have business cards?
I do, yeah, I'll put them in the back.
Good.
Yeah, and you can always call me if you have questions. I try to be really strict with people as to whether I think I can help or not, because it really doesn't benefit me to take anybody's money if I can't help. Like as a small business person, so we try to say, I'll tell you if I can help you, if I've helped people with your problem in the past, and if I don't know, I'll just say I don't know, but it's worth a try, right? And sometimes we'll say I don't think I can. So it's really, yeah, this method is really powerful for helping with a lot of things. And there's also, you know, a lot of acupuncturists in town. So there might be people who take your insurance, and I would look around.
It's very rare.
Yeah, Idaho's, you know, we love Idaho, but there's some issues politically here.
Bad.
So, you're recording this.
Yeah.
When you're ready,
Do you want me to email it to you?
well, I'd like to put it on our aphasia
Yeah.
Facebook page.
Yes, people can see it.
Up to you.
Yeah, absolutely.
Great.
I don't think I said anything too crazy, so.
You did. So thank you.
Yeah.
I really
Yeah, thank
appreciate
you.
it.
Thanks for having me, and thanks for listening.